So, about this Adult 1 course, it is a 16-week course. This is a big course with a lot of information, and really you're expected to spend at least 18 hours a week on this course. I highly recommend 18 hours a week, and I know that's a lot, especially if you're working, especially if you're a parent or have other things going on in life. If you are not able to fully invest in this class, it may show. So just know that it is a heavy, heavy course. It is exam heavy. It has a lot of content to cover. There are lots of quizzes and assignments that are very small points. And then the exams are very big points. This is really done because we are preparing you for NCLEX, which is, the final big test to become a nurse. So it is a lot for the theory course. But I will say a lot of people start out their first exam, they really struggle and they improve over time. C's make degrees sometimes. I was a straight C student in nursing school. Just know that if you are a previously person who loved making A's and B's, you possibly could make a C. If a lot of people really struggle with how to take nursing exams, so half this course is learning how to take an exam. Half of it really is the content. This is the big foundation for you to continue through nursing school. A reminder, your semester grade is a combination of both the theory grade and your clinical grade. The theory portion is 70% of your semester average. The clinical portion is 30% of your average. You have to pass the theory portion of this course with a 77% to pass the course. So even if your overall semester grade is a B because your clinical grade was an A, you still have to pass the theory portion, which is a 77%. I will keep reminding you this, but that is a big thing, right? Watch your theory grade. That is the one that you really want to not focus on, but that is the one you want to make sure is above 77%. It's super important that all of you really focus on this information because it's a foundation of being a good nurse. So when you get into it, each week is broken out into modules. This is so you can pace yourself in your learning. So for example, the first week you have the nutritional module, and then you have the assessment module for GI. So each one you go into, there'll be different pieces of assignments. I give you lots of learning options. So if you're a PowerPoint person, there'll be a PowerPoint. Whether that PowerPoint is just a PowerPoint with notes or it might be a PowerPoint with audio. I'm working on kind of combining the both. Each section will say a reading, like, hey, this is the portion you're supposed to read in your book in ATI. I also created study guides because especially the Lewis book is a lot of big information, and I kind of wanted to funnel it down for you. So if you are a person that likes to fill in the blanks, print off those study guides, and when you're reading, fill out that study guide because it's going to funnel the information that you need for this course. There is lots of SurePath quizzes. So once you finish all your information, there will be quizzes. These are graded that you can go in and complete every week. These practice questions, really, I encourage you to take your time going through because it gives you rationale of how to take an exam question too. And that's very important to build that foundation for your exams. I also will add extra different things such as YouTube videos that kind of condense things down, or there will be extra lessons in SurePath that you can go into and extra quizzes that you can go into that are not graded. But if that's the way you learn and that's the way you want to do it, go for it. Each week you will be able to see pretty clearly what is due that week. It could be pretty much every week is the SurePath quizzes. There's an end of the week quiz that are problems that are pretty hard compared to the SurePath quizzes, really wanting you to grow in your complexity of your understanding. And then there may be a case study. There may be a simulation. There's a couple of other things. ATI quizzes is the other one that you'll see that really help grow your knowledge. Be very aware when you're looking at your schedule that really you can turn things in late. The SurePath quizzes are very minimal points, but those do add up over time. If you miss one quiz, not a big deal, but it is important for your learning. So really try to stick up on your every week. This is what I need to do. This is what I need to do. Okay. You will have exams in week 4, 8, 11, 14, and a comprehensive exam in week 16. During these weeks, there's pretty much no reading, but you're expected to spend those 18 hours a week studying, okay? Going back through, making sure you can hit those extra practice in SurePath. You can really spend that time getting ready for those exams. I will also be doing exam reviews, and I will also be going through and seeing what's the highest missed questions in SurePath and talking through those problems and what's the best way to look at those problems. Nursing exams, completely different than anything else you're used to. You'll probably see some memes online that are pretty funny because it'll be like, nursing exam, which one of these is correct? And it's 3 pictures of an orange and 1 picture of an apple. That's very true. You will have maybe 2, maybe 3 answers that are completely correct, but you're trying to find the best answer. And this is real for nursing, right? You have 5 patients. All 5 patients need something. What is the most important patient you need to see first? What is the first intervention you need to do for this patient first? So this is really preparing you to be a great nurse and to be able to critically think through those scenarios. Usually people's exams, reminder, their exam grades improve throughout the course. Schedule time to be solo for those exams. That means if you're a parent, the video does flag if a kid runs through the room. I'm sure they're not giving you an answer of anatomy while they're running through the room, but you want to be able to focus on the room. We will talk about your room needs to be empty. You can't have notes in front of you. You'll have to be able to show the entire room just to make sure that while you're home, you aren't cheating yourself out of the knowledge that is needed. And then give yourself some wiggle room. Most exams are due Sunday at midnight. Especially the first exam, give yourself 24 hours because if something doesn't work with the internet, which you are required to have access to stable internet to take these exams. If you aren't able to access certain pieces, something happens, give yourself some wiggle room. So maybe plan like Saturday night, hey, I need to finish the exam. So if something goes wrong, you can do it on Sunday. The most difficult weeks, are week 5 and week 6. This is a lot of heavy information about fluid imbalances and acid-base imbalances. It is a very big structural thing. So if you want to look ahead and you're like, man, I need to take off some time from work. I need to make sure my kid has an extra daycare day so I can focus on week 5 and week 6. I recommend doing that. My office hours are going to be on Thursdays from I'm having to translate Mountain Time to Central Time. 1 p.m. Mountain Time, which is 2 p.m. Central Time, to 3 p.m. Central Time. This is not a lecture time. This is literally me online available for you if you have any questions. If some people get on and you have a question of like, hey, I don't understand potassium and its balance, then you and I can talk through that. We'll record it, or I'll write up a little thing that I'll post in the announcement. So if you're not able to go to those office hours, you can still learn from them. The other thing is my response time is usually 24 hours on weekdays, and then weekends, not required to respond, but I'm a full-time mom. I probably will try to respond. If I don't respond to you in the 24 hours, feel free to email me. Again, it's not going to hurt my feelings if you're like, hey, I emailed you 24 hours about this and I haven't heard anything. I'm happy to then answer, right? Sometimes I will get anywhere from 5 to 20 emails in a day, and I might miss a response. So feel free, it doesn't offend me. Please communicate with me. That is the biggest thing with these online courses is communication. So if you have issues, please communicate with me. That being said, I recommend reading through all instructions twice before emailing me. I've had situations in the past where somebody's like, hey, I don't understand this assignment, and if you go in the instructions, it says exactly when it's due, exactly and answered their questions. If I get a email that somebody's like, hey, can you clarify this? And I'm like, man, the instructions are not clear, I will go back into the instructions and update them. So just before you email, just read through the instructions twice just to make sure. Everything is kind of time specific. Keep up to date week by week. If you start to fall behind, communicate with me. And that's the big things with these course. I wish you the best of luck. It is a difficult course, but I hope you learn so much, and it's really the foundation for your nursing. So thank you, and letting me know if you have any questions.